Good morning, everybody. Thank you for joining us. As some of you might know, I'm Tony from McLaren St. Family Medicine for the last time. Because in 2 weeks, we're switching over to becoming Mercy Health, St. Luke's Family Medicine. But despite the change, we will continue to come here the third Wednesday of each month and give a talk on a different medical topic. Today, we have Dr. Parker Auerkamp that's going to talk about hearing and vision loss. So as we get older, we worry about a lot of things and a lot of changes that happen. But two things we really worry about are hearing and vision, because those are both connected to who we are as a person. And we rely on those two senses to help us maintain our independence and our stability in our day-to-day living. So he has some good information about each of those and how things change as we get older, but some additional information as well. So I'm going to turn it over to him, and then we'll stick around in case you have any personal questions.
Thanks for having me today. It's good to be with you. Today, we're going to, as he said, talk about hearing and vision changes as we get older. We're going to kind of start with hearing, and then we'll talk about vision a little bit later. So some fun facts about hearing, and we kind of mentioned this before, that about 33% of adults aged 60 to 70 has some sort of hearing loss. And that number gets higher as we hit 80 to 85 years old, up to 80% can have some sort of hearing loss or changes. And so it's a good topic to talk about because it definitely affects a lot of people. Interestingly, between men and women, men usually have a greater hearing loss and earlier on compared to women. And so whenever I see couples in my office, I try to hone in and make sure, are there any changes that the men are experiencing? Or a lot of times I'll ask their wives to keep an eye out to see if they've noticed anything about changes or turning the TV up louder or having a hard time hearing in crowded rooms and things like that. After 60 years old, we see a gradual decline that's kind of age-related. The way that we measure hearing is through decibels. That's kind of their way of how they gauge sound. And we see that we lose about 1 decibel each year after 60 years old. And so it's this kind of gradual decline that we see a lot in the aging population. And because it's so gradual, a lot of times we don't catch it right away. And it's a condition that can be under-recognized or under-treated for a lot of the population, especially if you're not seeing kind of a doctor from year to year or things like that, and you're not keeping an eye out for it. They can kind of sneak up on you and become more problematic. And so we have this nice kind of picture up here, and that's showing the different parts of the ear, because some of the different common things that can cause hearing loss can affect different parts of the ear. In the green, you see the outer ear, and then in the kind of tan color is the middle ear, and then the blue is the inner ear, where it's kind of almost into the brain with the nerves. And some of the different common causes that we'll talk about affect each of those areas. So kind of starting the outside in, we talk about the conductive hearing losses, and that's any condition that's kind of keeping the sound from reaching the ear. And this can be caused from a number of different things. The most common is earwax buildup. And that's something that I've seen a lot of patients have, where sometimes even for their whole lives, they just develop more earwax, and sometimes they have to get it cleaned out. We fix this by getting the wax out and trying to do it safely to where it protects the ear. This can be worsened sometimes by using Q-tips. I always think of, in the old Revolutionary War weapons, they have those big cannons that they're using the musket to load up the cannonball. And that's kind of what we see happen sometimes. If you have some wax in there, and then you're sticking a Q-tip, you're just kind of loading all of that wax into that ear, and it can get stuck and hard to get out. You can also poke your eardrum sometimes, and that's not good for your hearing either. And so one of the ways that we usually recommend helping with that earwax is something that little eardrops you can do to help soften up the earwax. Some common brands or Debrox or peroxide, things like that, your physician could recommend to help keep that wax nice and soft. That way, when you take a bath or take a shower, that moisture will help kind of release that wax and have it drain on its own, so it doesn't get built up. If it does get built up, you can always go in and see your doctor, and they have different ways that they can safely get that wax out of the way. Other things that can get in the way are foreign bodies. You know, you think more as kids of, you know, them sticking a bead or an M&M or something in their ear and having it get stuck, but it can happen older in life too, that sometimes an earring or a portion of a hearing aid or something, or even a bug or an insect can sometimes climb in there and block the ear's ability to get sound waves. And so when that happens, it's best to be checked out by a doctor and have someone safely kind of get it out there. There's some other things that can happen. The next one we see is a perforated eardrum. That's when, for whatever reason, you can actually get a little hole in the eardrum. And the eardrum functions by vibrating and reacting to those sound waves. And if you get a hole in it, it's kind of like trying to use a drum with a hole. It doesn't really work. And so when that happens, kind of seeing an appropriate healthcare person that can either help close up that ear or get you in a situation where you can hear better. And then there's kind of some other things, tympanosclerosis. That's sometimes when you can get sclerosis or kind of thickened skin elsewhere on your bodies or kind of plaque buildup, that can sometimes happen in your ear, where there's a little bit extra skin tissue and things that can build up on your eardrum and can cause difficulty with hearing. And there's different things that that your doctor can do to kind of help with those. Another one is a ear infection. You know, again, we think of this the young population, and kids see this a lot, but we can definitely get ear infections as we get older too. And if there's fluid or infection in there, that can sometimes make it harder to hear. And so whether that's finding antibiotics or proper treatments, that can help resolve that and make it easier to hear. So moving on kind of into the ear. So now we've covered all the things that block the sound from getting to the ear. Then there's the sensory neuro ones, and those are ones that the nerve is having a hard time working right, where the sound's coming in, but you're having a little bit harder time converting that to sound. And the most common that we see is presbycusis. That's a fancy kind of term that they have for the natural decrease in hearing as we get older. How we talked about before, how the eardrum really acts like a drum, where it vibrates and it reacts to it. As we get older, it gets a little stiffer and it doesn't vibrate and is as malleable as it is when we're younger. And because of that, it causes a gradual kind of decrease in hearing. A lot of times we'll notice it with higher frequency noises. And so sometimes it'll be harder to hear grandkids or hear children because they have a higher pitch to their voice. Sometimes it can be harder to hear women, or if you're in a crowded room where there's a lot of people talking, that causes a higher frequency and it makes it a little harder to hear. By far the most common, because most people get it to some degree as they get older, and that causes that little decibel decrease. It usually happens in both ears, and so we expect it to kind of affect both sides. And this can get worse if you have other kind of insults to the ears. If you're around loud noises a lot, really loud headphones, if you had occupational exposure, like you worked in a loud factory. Some of my veterans, if you have exposure to the firing range or guns or loud things like that, firecrackers, that can kind of speed up that gradual hearing decline. And so one of the things I always recommend for my patients is trying to protect your ears. If you're in a situation like that, you're working on the firing range, you're in a factory, trying to have some type of protective earwear to try to help your ears so that they don't get that gradual kind of injury over time. And the number one way that we treat this is with hearing aids. Since that eardrum is just a little bit less responsive, we can use hearing aids to kind of amplify that incoming sounds to try to help with some of that hearing loss. And then this is a nice kind of diagram here. So this is when we're testing the ears. And so here is high frequency at the top and low frequency, and then it's how well you can hear. And so as we see, This is getting older. So as you're young, you're able to hear a lot of different frequencies. And then as you get older, you'll see that there starts to be a little drop off. And you'll see that for kind of the high frequency pitches that we were talking about. And so, young children's voices, sometimes female voices, or voices in a crowded room, that's where we start to see that drop off in being able to hear. And that's where hearing aids can particularly help with those high frequency noises to help make up for that deficit. And we see, so in the pink, that's among women, and the blue, that's among men. And you see how there's a little steeper of a drop off in that male population, particularly in those high frequency noises, kind of reinforcing what we talked about before, that we see it a little more often in men compared to women. And then the graph underneath, this is a nice, when we were talking about decibels before, this is kind of telling us what type of sounds are at what decibels. And so, at the very bottom, 20 decibels, that's like leaves rustling, or it's pretty low. And this goes up with volume. And so we talked about how we want to avoid loud noises. And so if someone's whispering, that's at 40 decibels for reference. A normal conversation that you'd be having is about 60 decibels. And then 85 decibels is kind of busy city traffic. If you're out walking on the street and you hear the busy cars go by, that's about 85 decibels, which is around the healthy kind of safe range that we want to have our hearing. Anything above 85 decibels gets in that range where it could kind of cause a little bit of irritation to the ears, which is a little lower than most people would think about. And so kind of moving up before that, even a hair dryer, when it's blowing straight in your ear, that's technically around 90 decibels, which is just higher than what's usually recommended. Now, if you're using it for a few minutes and you're doing your hair, then that's probably okay, but you wouldn't want a really long exposure to it over time. Same with MP3 players, or if you had headphones in that were turned up too loud, that can reach 100, 110 decibels and kind of cause some of that irritation. And then it goes up from there. If you're at a concert, or if you're right next to a plane that's taking off, that can reach 120 decibels and cause some irritation. Yep, so you want to either have some protective hearing or kind of cover your ears or something when that's happening. So to avoid any injury to the ears. Some other causes that we see that can impact your hearing is what we call kind of the toxic exposures, and that can mean a lot of different things. That can be exposure to things that aren't good for your ears, and that can even be certain medications that can have side effects of impacting your hearing. There's certain drugs like diuretics or water pills for certain kidney conditions, certain antibiotics, and certain kind of chemotherapy regimens can possibly have side effects to the ears. And so that's why, just like with all medications, whenever you're starting a medication, having a conversation with your doctor of, is there any side effects I need to be aware of? If you already have some hearing issues, it's a reasonable question to ask, will any of these new medications affect my hearing or things like that, so that you can be mindful of anything that could be happening. And obviously the treatment is, if you can, stopping the medications that's harming your hearing, or finding safe alternatives or things like that. Another one that we have is Meniere's disease. It's kind of a fancy French term for a hearing condition. It's similar to kind of like how we were talking about kidneys. So sometimes you can get swelling in the legs if you have fluid buildup. A similar thing can kind of happen with your ears, where that ear compartment can have a little bit of fluid that swells, and it makes it a little harder for the sound waves to get through. And so the way that you treat it is kind of the same way that you treat swelling in your legs, where you can use a certain medication to help kind of bring down those fluid levels, and that can help with the kind of hearing issues that you have. It can frequently be on one side instead of affecting both. For whatever reason, you can have a little more fluid accumulation on one side or the other. I'm not exactly sure. But yeah, you can also have kind of ringing in the ears, or a little sense of vertigo is one of the things that can tip you or your doctor off that may be the cause of what's going on. And for this particular condition, hearing aids usually don't seem to help. And so if you're having some hearing loss, you have those symptoms and you try hearing aids and that's not helping, this may be the condition that you have. And then there's going into the idiopathic sudden hearing loss. That's the fancy term of saying if all of a sudden you just can't hear out of one of your ears. And that one, you want to jump on that pretty quick, because these other ones we've been talking about, they're gradual changes that we see, usually affecting both sides of the ear. If for whatever reason you wake up one morning and you can't hear in an ear compared to the other, that'd be a good reason to, call your doctor, get that checked out. Because there can be a lot of different things that can cause that, and most of them require a little bit more urgent evaluation. I'm kind of transitioning from hearing to vision loss now. Same type of distribution that we see where it becomes more common as we get older. About 33% of the population will report some type of reduced vision by the time they're age 65. And this, just like hearing, will kind of increase as we get older too, into our 70s and 80s. That's why the American Academy of Ophthalmology, they recommend having just kind of routine screenings and eye exams, because just like with hearing, it can be a very gradual thing that we may not notice has changed, but it can be helpful to have kind of a standardized screening now and then to be able to see if there's any changes going on with our eyes. One of the most common things that we find is macular degeneration. And this is one that we see as we get older, kind of similar to the ear, how when we get older, there's kind of little changes in how the ear moves and functions. It's the same with the eye, where it's a little bit less reactive. There's some kind of age-related changes that make it a little bit harder to see. Usually with these, it starts kind of affecting the central vision more. And so you may be able to see all right in the outsides, but kind of that central vision starts to get a little blurry, starts to get a little harder to focus on things. That's the most common cause of vision loss after 65 as we get older. The risk factors for this, one is age, just as you get older. If you have a family history of macular degeneration, you have a little bit increased chance of having it yourself. And then things like high blood pressure. High blood pressure is something that affects all of our vessels, but it particularly affects the areas of our bodies that have very small blood vessels. And so the eyes are an area that have very small blood vessels, and they can be kind of damaged if our blood pressure is too high. And so that's why we can see an acceleration in these changes in the eye if we have blood pressure that's uncontrolled for a long period of time. So that's one reason why your doctor is so worried about the blood pressure. For a lot of other reasons is to help keep your eyesight. And another one we see is smoking is a risk factor too. Just like how smoking isn't good for the lungs, it's also not good for your blood vessels, as we talked about in the eyes. They can affect that as well and make the vision loss worse. Symptoms that you'll frequently see can cause blurry vision, a little bit of image distortion. Usually it doesn't cause total blindness, but just a harder time focusing and seeing what's going on. And we'll see this worse at nighttime. Kind of night vision will get a little harder as well with this. And then prevention, like we said, treating the high blood pressure, not smoking, keeping up with regular eye exams, things like that. And then treatment, there's different things we can do. There's glasses, there's certain kind of laser therapies that you can do, different vitamins to just kind of help with the eye health overall, using reading glasses and things like that. Another one that we see is glaucoma. And this one can be from a couple of different reasons. One, we see it in our diabetic population. If we're not having good control of our blood sugars and they're running too high, that can sometimes cause some glaucoma and some damage to the eye. This happens from an increase in pressure. Your eye is kind of filled with fluid, and there's fluid going in and there's fluid going out. And when we have this glaucoma, the fluid kind of builds up and it increases that pressure and it has a harder time draining. And that increased pressure can sometimes cause damage to the eye and can cause some vision loss. And so we talked about most common risk factors: age, diabetes, family history, high blood pressure, smoking. all of the things that kind of cause our eyes to have little sources of damage. Prevention for this, getting your eyes checked, you know, if you've ever gone to the optometrist, that's the one when they shoot the little puff of air in your eyes. That's what they're checking for. They shoot the puff of air and they see how the eye moves, and they can kind of tell the pressure in your eye. So that's why they shoot the air at you. And yeah, if that is what you have, there's certain eye drops that they can use to help relax and help relieve that pressure and things like that. Another common one that we see is cataracts, which some people may be familiar with. This is the most common cause of blindness worldwide. And this, again, goes up with age. Risk factors are UV exposure or being out in the sun. And so the number one way that we recommend for helping prevent this is wearing sunglasses when you're outside. Because those sun rays with the UVs, they come in and they make a little tiny injuries to the eye, and they can build up cataracts. And so even my young population, my teenagers, you know, if they're outside, if they're in the sun a lot, I always recommend wearing protective sunglasses or eyewear with UV protection so that they decrease the risk of getting cataracts later on in life. Treatments that you can do for it, if it builds up, ophthalmologists, they have different procedures. You can sometimes have cataract surgery where they can remove that buildup, remove the lens, different things to try to help with that. And then the last one that we're going to talk about today is diabetic retinopathy. Just like how diabetes can increase your risk for glaucoma, it can also have the effects of causing a retinopathy, or kind of a damage to the eyes. Similar to how high blood pressure can affect your vessels, diabetes can also affect your vessels and affect your nerves and how things function. And if we have really high blood pressure, really high blood sugar for a long time, just like it can damage the nerves in your feet and give you some numbness, it can also damage the nerves in your eye and make it a little bit harder to see. And so the main thing that we do for prevention is, you know, we monitor your blood sugar, make sure that you don't have uncontrolled diabetes. And then for treatment, same type of thing where you can treat the diabetes. If it's become worse, there's certain procedures that the ophthalmologist can do, certain laser treatments and things like that to try to help the health of the eye. And so that's kind of what we prepared today of some of the common causes of decreased hearing and vision. Any questions that anyone has today?